big shout out to you for making it through the hectic holiday season. This new year, get clean, quality, pregnancy nutrient support off your to-do list, including Ritual's best-selling Essential Prenatal Multivitamin, designed with 12 traceable key ingredients to support a healthy pregnancy. With big changes coming up, take the small steps now and start today with 30% off a 3-month supply at ritual.com/podcast. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
Welcome back, one and all. It's your girl, Ash Brown. This is the Ash Said It Daily podcast show. I appreciate you guys for all of your love and support. I appreciate you so very much. Over 1,000 episodes, 500,000 streams, and growing. Would not be possible without you guys, so I thank you. Continue to follow me across social at OneLoveAsh, and those Girls Night Out tickets are almost sold out. So if you're here in the Metro Atlanta area, you want to get into those premiere tickets for the Ocean's 8 movie starring Sandra Bullock, Rihanna, and a host of others, jump onto the website and get your tickets now. Today, I'm joined by Dr. Jane Frederick. Hey, Dr. Jane.
Hi, thanks for having me.
Thank you so much for joining us. I know that you're a busy lady with a full schedule, so I appreciate you so much for having time for us.
Great.
All right, Dr. Jane. So this month, March, is Endometriosis Awareness Month. For our audience that are not familiar with endometriosis, what is this disease?
Well, endometriosis is actually a very common disorder in many women who are complaining of painful menstrual cramps. Sometimes there can be cysts on the ovary. We call those endometriomas. And a lot of patients can actually have infertility issues, which is why they get to my clinic as the infertility specialist. And basically, the disease affects the reproductive age women, and it's a retrograde menstruation. So instead of menstruating outside the vagina like normal, some of those cells will also menstruate internally. And the cells that menstruate internally can cause scarring and cysts every month around the fallopian tube and the ovary. So that's where we make the diagnosis based on symptoms. And then we can do an ultrasound also to look at the cyst. And final diagnosis is made through a surgical procedure called a laparoscopy. You have to actually visualize the pelvic organs to be able to make the diagnosis to know for sure it's endometriosis. So it is definitely something to be aware of, and it can be easily diagnosed and it can be treated very easily, and those patients can go on to get pregnant.
Yeah. Now, it's a topic that's pretty close to me because my mother suffered from it for many, many years. So I grew up hearing about the symptoms and seeing the different treatments that she had to go through and dealing with it and treating it. So what are some of the things that women can look forward to as far as being diagnosed with it and living a normal life?
Well, first of all, I recommend if you're having these symptoms that you seek out a specialist. And you can start with a gynecologist, or you can go straight to the reproductive endocrinologist, someone whose specialty is familiar with endometriosis. And I would do testing first to see where the pain is on her cycle. I would check the ovaries with an ultrasound. And then if she's not trying to get pregnant, there are ways to alleviate the pain, which is what most patients complain of. And one of the most successful ways is birth control pills. So birth control pills actually help to lessen the extent of the endometriosis because it makes your period be much lighter. And that in turn can allow the cyst to not form, and it can allow the patient to have a more normal life. So in those patients who are not trying to get pregnant, birth control pills are a primary source of treatment. In those patients where birth control methods have not worked, then perhaps a surgical procedure called a laparoscopy might be indicated. And the laparoscopy allows us to go in through the camera, the laparoscope, belly button incision, outpatient surgery, and we can actually take away the areas of endometriosis and allow that tissue to heal so the symptoms can go down at that point. A lot of patients will actually conceive if they're trying to get pregnant after the laparoscopic surgical treatment. So that is also a way to treat the disease and to help those who are also trying to conceive. The third option is if a woman's trying to get pregnant and she has the endometriosis, we can actually utilize a drug called Clomid to help her ovulate and conceive, because pregnancy in itself will cause the endometriosis to become dormant. So that pregnancy is actually a treatment in itself for patients with endometriosis. The interesting thing about this disease is that the severity of the disease does not always equate to the severity of symptoms. So I've had patients who have had 4 children, never had a painful cramp, and then on the last child, at the time of the C-section, for example, I would see stage 4 endometriosis, and she's never had a symptom. And then I've also had patients with very severe cramps and dysmenorrhea or painful period, and she has a very mild form of endometriosis or stage 1 disease. So the severity of the disease and the severity of the symptoms do not always correlate. But in the back of our mind, we are always searching for reasons why women are complaining of these painful cramps, and that can be one of them.
Absolutely. All right. So we're going to take a brief break. When we come back, we're talking more with Dr. Jane and really get into the nitty-gritty about endometriosis and how each and every one of you all need to get tested. If you're feeling something is not right with your body, it's worth getting it checked out. So hang tight with me, and we'll be right back. You spend 1/3 of your life sleeping. Why not make it comfortable with Casper? Ash Brown here from Ash Said It Daily. Casper products are cleverly designed to mimic human curves, providing supportive comfort for all body types. When I'm touring around the world, there's always one important detail missing: my Casper bed. I can't wait to get home for a restful night's sleep. There's nothing like it. The experts at Casper work tirelessly to make a quality sleep surface that cradles your natural geometry in all the right places. The prices are affordable because Casper cuts out the middleman and sells directly to you. They're all designed, developed, and assembled right here in the U.S. Don't forget about Casper's 100-night risk-free Sleep On It trial. Get $50 towards select mattresses by visiting casper.com/ash and using ASH, ASH, at checkout. Terms and conditions apply. Get your Casper mattress for a restful night. Visit casper.com/ash. Promo code ASH. Welcome back, you guys. It's your girl, Ash Brown. We're talking with Dr. Jane Frederick today. It is Endometriosis Awareness Month, and so we're talking all about women's health and how women need to be keeping themselves up and being aware of what's going on with your body. Now, Dr. Jane, for you, as you were, I'm sure, going through medical school and everything, why did you decide on women's health?
Well, I have always wanted to use my skills as a physician to empower women to be more proactive about their health. So for me, the study of women's health and being an OBGYN and then specializing in infertility, it's really been about trying to educate more women about their bodies and allowing them to have more control over their reproductive choices. So infertility, for me, is just like we have control about our birth control methods, about when we want to have a baby. I also feel it's important for women to have control about the reproductive choices and to know that there are ways out there to get pregnant. You don't have to feel that you're alone or that it's never going to work. But I always want to encourage women to seek advice from a specialist like myself and know that we have so many options for you if you're trying to have a baby and you're struggling with infertility. It's
Mm-hmm.
always been a passion of mine to empower women to be stronger about themselves.
All right. And getting back into endometriosis, can it be um, can it be an inherited disease? Could a mother pass it on to her
Yes,
daughter?
we do find that many women, when I ask the question in the history, are there any sisters or moms or aunts or grandmothers that have this disease, that there is a family history of this type of symptom and diagnosis. So it's
Mm-hmm.
always good to know what your mom's reproductive health was,
Mm-hmm.
or your sister or mom's sister. That really does give us a better idea of your genetic family tree.
Mm. And you talked earlier about stages of endometriosis. What would, I guess, categorize stage 1 versus stage 4?
Well, stage 1 endometriosis is a very mild form of this disease. So, in the laparoscopic procedure that I mentioned, where we make the diagnosis of endometriosis, we would see very few areas of implant of these endometrial cells in the ovary or in the tube, or they'd be very minimal amounts. Versus stage 4 endometriosis at the time of surgery, I would actually see blocked tubes, tubes that are fallopian tubes that are swollen because of the blockage. I can see a lot of pelvic adhesions or scar tissue around the pelvic organs, and the anatomy would be very much distorted on a stage 4 endometriosis versus a stage 1.
Mm, gotcha. Last but certainly not least, Dr. Jane, what do you want women out there to know about endometriosis and being aware of any symptoms?
Well, that is an excellent question, because I think as women, we tend to um, marginalize our symptoms. And we think, well, it'll go away, or, I don't have time for this. And so we don't seek out help with how we're feeling, with our chronic pain that we're having. And I would encourage women, go see your doctor. If you know that your body's not feeling right, or your menstrual cycles are severely painful, seek out your doctor, your gynecologist, or the specialist, the reproductive endocrinologist. Seek out someone who can actually do some tests for you and help to see whether you have this diagnosis or not. It is very treatable, and I really want to tell your listeners that this is not cancer, and you can certainly have a baby with this diagnosis. I have so many miracle babies born through in vitro fertilization from patients with stage 4 endometriosis. So there really are options. That's the message. And please note that you're not the only one who's having painful periods. You are not the only one that feels I should just ignore this. Don't ignore your body. Seek out some expert advice.
Seek out expert advice. Sounds like a plan. Dr. Jane, if people need to reach you, if they've got questions, or maybe they need to come into your office, what's the best way to get in contact with you?
So I have a website. It is www.havingbabies.com. And they can reach me on the website. They can also, my office is in Newport Beach in the Orange County, California area. And I am happy to answer emails. If patients have an email random, they can reach me through Frederick, IVF, at havingbabies.com. I try to be very accessible to my patients, and I encourage your listeners to think about getting advice if they need it.
Absolutely. That's the best word that I've heard all day. Definitely get some advice. Dr. Jane Frederick, thank you so much for joining us today. We appreciate your kind words and your encouraging words for anyone out there that may be dealing with reproductive issues. Dr. Jane said, go get an opinion, get a professional opinion. All right. Google is not our friend always. So
Yes, thank you for doing this. It's a great topic. You're going to
yes,
reach a lot of people.
I definitely think so. I do. But thank you so much, you guys, and keep pushing forward no matter what. Anyone to tell you that you can't do what you want to do, you look them square in the face and tell them, don't believe me, just watch. Watch what I do. Watch me make it happen. Watch me make history. That's what we're doing this for. We're doing this for the history books. Social media is nice, but real life is so much better. Until next time, you guys.